Welcome to Healthy Life. I'm Dr. Timothy Johnson. Our first topic today is so-called heartburn. Our guest is Dr. Jutabha, Associate Professor of Medicine in the Division of Digestive Diseases at UCLA Medical School. He joins us from our Los Angeles Bureau. Welcome, Dr. Jutabha.
Yes, how are you doing, Dr. Johnson?
I am very well, thank you. Let's do a little definition right at the start. The difference briefly between heartburn, reflux, and hiatal hernia, which gets thrown in the mix.
Well, reflux and heartburn are one and the same. GERD is also another term that's used. It stands for gastroesophageal reflux disease, and that's related to acid coming back into the esophagus and irritating it, causing the symptoms. As far as hiatal hernia is concerned, that's an anatomic definition, which means a weakening in the diaphragm where the stomach slides up into the chest, up in the esophageal region, which is a risk factor for reflux disease.
And so when stomach acid gets back up into the lower end of the food pipe or the esophagus, what are the potential symptoms and long-term dangers if it's a chronic condition?
Well, it can irritate and damage the lining of the esophagus, which can lead to ulcers, which can then heal and cause scarring or strictures or narrowings, and it can lead to a precancerous condition called Barrett's esophagus.
Should people who have what appears to be significant heartburn get a thorough checkup from a doctor like you, a specialist, or their primary care doctor, or should they just start using some of the over-counter products that are advertised for heartburn and see if it gets better?
Well, heartburn is such a very common condition. It's related to a number of different factors. Food is a risk factor, as well as activity, as well as weight. And so that I would say that for most people who have rare occasions of heartburn, they can just go to the drugstore, get over-the-counter medications. However, if they have symptoms more frequently, then they should undergo evaluation by their primary care physician, who can prescribe stronger medications. And if that doesn't work, then they should go seek advice from a specialist, a gastroenterologist.
Let's talk about an evaluation, as you put it. Let's say somebody is having a chronic problem not solved by the over-counter medications. If they come to you as a specialist, what kind of an evaluation are you going to do initially?
Well, after getting a thorough history and doing a physical, we would then want to examine the lining of the esophagus directly with a camera. And there are a number of different ways that we can do that. The standard way is endoscopy, where we have a tube that has a light and a channel at the end of it, and we can actually go down there, examine the esophagus, and take specimens. Nowadays, there are new diagnostic modalities that can be used. One of them is actually PillCam endoscopy.
And I understand you have that with you, so we can get some idea of what you're talking about if you'll just hold it
Yes.
up. When
Yes,
you say
I'll hold it up
PillCam,
for
it's
you.
obviously a pill with a camera in it. How does it work?
Exactly. And so what it is, it's got two cameras on either end, as you can see here, and it takes 7 pictures a second on either end, so 14 pictures a second. You swallow the capsule, and then it transmits the picture to a data recorder, which is then downloaded, and then we can view the images. So rather than having that tube down the throat, you just swallow the capsule and we'll get very high quality images.
And I must say that I actually swallowed this once as a part of a story recently. A very easy procedure. So easy, in fact,
Yes.
that I worry that maybe there will be a temptation to do it on almost everybody who walks in the office. How do you decide who really needs this PillCam screening and who can wait to see what develops?
Well, I think it's really a clinical judgment, and that's why you should seek advice from your physician first. The procedure itself is relatively safe, and so that as a screening tool, it's an ideal procedure. Some of the contraindications where you would not want to do PillCam ESO is basically if you have an obstruction or you have a swallowing disorder. Other than that, if you have an indication to have the examination, that this is the ideal screening tool.
And then if you find something suspicious, you could then proceed to the endoscope and get actual biopsy samples.
Yes, that's correct. And in that situation, you would need to get sedation, and we can do the biopsy. You'll have to take the rest of the day off. And so that's why the PillCam makes sense as a screening modality.
finally, as a practical matter, what are some of the traditional tips that you give to people who are suffering from intermittent heartburn that can make it easier?
Things that are within their control short of medications are lifestyle modifications. These include avoiding eating food before going to bed, sleeping at an incline when they rest. They can take some over-the-counter medications. They want to try to lose weight and avoid foods which promote reflux.
So
I can go through that list if you like.
A lot of us can talk about lifestyle measures as maybe all we will need to at least control mild intermittent heartburn.
Yes, that's correct.
All right. Well, we thank you for this very good survey and a reminder of the exciting, interesting new technique, the PillCam. Thanks for being with us, Dr. Jutabha.
Yes, my pleasure, Dr. Johnson.